Our next presentation is going to be on nutrition for gastric cancer, and our speaker is Martha Ryall, also from Duke.
All right. Like she said, I am a dietitian at Duke Cancer Center, and I help people with nutrition, whether that's symptom management, helping them keep their weight, or advising them on what they should eat, especially after surgery, and then just kind of helping them through treatment. So I'm going to start out with the basics of healthy eating during cancer, preventative-wise, whether you're in remission or even through treatment, what's the best for you. So studies have found fresh fruits and vegetables, whole grains, and legumes. Legumes are anything that are beans, lentils, chickpeas, anything kind of in that area. They're filled with thousands and thousands of vitamins and minerals and phytonutrients that we don't understand exactly how they work, but for some reason they help to fight off cancer. Each one has their own different rules, so our own different benefits. So trying to get a variety of them. Each color of each fruit or vegetable brings a different nutrient than another one can't. So trying to get as many of those in the diet. They are better than supplements. A lot of people come asking about supplements they can take during treatment. First off, with supplementation, no studies have found that they are actually beneficial. When you're looking for vitamins and minerals, they're extremely beneficial when you find them in the whole foods, but no studies have found that they help with cancer when taken in a pill. So there's no need to. A multivitamin can be beneficial. When looking for a multivitamin, especially if you're not eating a lot, I like to go and look on the back of the panel. You know, it gives all the lists of vitamins and minerals depending on if it has those, which ones it has. Then it has the daily value. It will have a percentage. You want to make sure none of them go above 100%. And I'll talk about why in just a second. And then sometimes what I even recommend, I know it may sound a little bit strange, is if you do want to take a multivitamin and you can't find that one that doesn't have everything go over 100%, is to look for a prenatal vitamin, because oftentimes they stay within the recommended guidelines because they're trying to protect the baby. So that's often a recommendation I give. Other ones that can be beneficial are omega-3 fatty acids, vitamin D, and calcium as well, just because Americans, and just general population, we tend to lack in those nutrients. However, with gastric cancer in specific, you need to be careful with these types of foods because they can fill you up quickly. They have a lot of fiber in them, which is very beneficial, but they also take up a lot of room in your space, and I know a lot of times with gastric cancer, there's a difficulty keeping your weight on. And so you don't want to fill up with these foods or just eat only these foods, okay? Next, I want to talk about some cancer myths. Questions I get a lot of questions about. The first one, does sugar feed cancer? That theory comes from, you take a PET scan, they inject the glucose, and the tumor almost lights up. And so you're thinking, oh, the sugar must feed the cancer then. And that's not actually true. The sugar actually feeds your entire body. It just happens to be metabolized by the tumor faster than the other cells. However, with this, you need to be careful be picky with your sugars. Not all the time, but not all sugars are created equal. Not all carbohydrates are created equal. Your body needs carbohydrates, which turn into sugars, to function, to live. Your body actually works. Your brain and your nervous system run on carbohydrates. And so it's important to have them in your diet. And so with that, you want to do the sugars found in more whole foods. Your fruits, your whole grain breads, and whole grain anything, quinoa, brown rice, anything like that is going to be very beneficial. What does feed the cancer, in a sense, is your insulin. Insulin increases cell growth. So you want to try and make it so your insulin doesn't spike. Things that help insulin spike more are the refined and processed foods. Now, if you can eat them with protein, or you can eat them with fat, or have fiber when you're eating them, it's going to slow down so your blood sugar isn't going to spike as much. That's why an apple is going to be much better for you than a tablespoon of sugar, because the fiber in them and all the vitamins and minerals in them are going to slow the curve of your blood sugar spiking up, and which, when your blood sugar spikes, that's what produces more insulin. Okay? So please, please don't get rid of all carbohydrates. They are very, very beneficial for you. The next one would be the ketogenic diet. Like I mentioned before, it's very important to have carbohydrates in our diet. Also, I want to make a mention about the real ketogenic diet and the current fad ketogenic diet. The real ketogenic diet was originally used to, and still is used to, help treat seizures in little children. And it actually can really work in many cases. However, this is a very, very, very controlled diet where you are measuring everything out in grams. You can only have a tiny bit of carbohydrates. Like, we're talking, these kids will eat like lots and lots of pepperoni slices with like heavy cream and cheese and like a tablespoon of tomato sauce. Very, very little. Now, your fad diet, ketogenic diet, you're allowed berries, and you're allowed like almost all vegetables except for the starchy vegetables, such as like potatoes and peas and corn and things like that. And you eat lots of meat and lots of fat. And oftentimes when I see patients who claim to be on the ketogenic diet, I look at their blood sugars and they're usually around 95. To be following the ketogenic diet, you aim for a blood sugar between like 50 and 70 to 75. So the fad diet, ketogenic diet, isn't really even the ketogenic diet. So there are few studies, more research is coming out with the effects of the ketogenic diet and cancer. Most of the studies are actually done with brain cancer because the ketones are what feed the brain when your body doesn't have enough carbohydrates in them. So the only thing I was able to find on all the different things, there are very, very few studies, and on very few small studies done. A lot of them are small because, honestly, most people drop out because the diet is way too hard to follow, which should say something within itself. And there are small suggestions that the people who do stay in the study have better quality of life during treatment. But very little research is done, so we don't even know if that's a thing. It's just something at the end of the studies, it basically says, hey, maybe this is something we need to research further. And remember, these studies are done on brain cancer patients too. So overall, I don't really recommend it. If you want to do it, since your body isn't actually usually the current fad diet, that's what most people are following, it's not going to be too harmful. It's not going to be harmful, but I don't recommend it. Also because with it, you're cutting out a lot of your nutrients that you find in those fresh fruits and vegetables by following the ketogenic diet, which have been proven to be beneficial with cancer. Okay, so during treatment, surgery, whatever it is, your number one goal for patients is always to maintain your weight, or if you're underweight or grossly underweight, then to gain weight. And this is important to remember because we just went over what is required in what you want in a healthy diet, but some people get so caught up in a healthy diet that they say, oh, hey, I'm eating a ton, but they're really not eating a lot. Like I had a patient who's like, I'm adding more in my diet, I'm eating so much, and she'd have a little bit of shrimp, and then she'd have like zoodles, which are those zucchini noodles, and then like some other type of vegetable. And I'm like, well, those vegetables you have there fill up a ton of your plate, but provide very, very few calories. So your number one goal is to maintain your weight as much as possible. Okay, so protein. is my number one recommendation for helping you not only maintain your weight, but it's also healthy during treatment. Why is it important? Oftentimes in critically ill patients or patients going through a lot of different treatments, we are in negative nitrogen balance. What does that mean? It means that, like a healthy, normal person, when they take in protein, they excrete about the same amount out. They're kind of in a balance. However, when you're critically ill, you take in protein and you're excreting out more protein than what you ingest. So where does that extra protein come from? Often comes from your muscles. So when you're losing weight, you're not just losing fat, but you're losing muscle as well. And you often see it in your arms, you'll see it around your clavicles, in your face, around your temporal region. And so it's very important to get enough protein in. Also with any therapies that you're going through, chemotherapy, radiation, their job is to target the cancer cells, and they're breaking down. Radiation targets them specifically, chemo goes throughout the whole body, and so you need protein to rebuild back up healthy cells and repair the healthy cells that were damaged, because protein is the building blocks. They're the building blocks of your body. Okay? So where can you find this protein? Most basic ones: meat, fish, poultry, and eggs. Any type of protein that comes from an animal is going to be it's going to be better accepted in our body because the protein is closer matched to the same type of protein we use. And so our body can use it better. So meat, fish, poultry, recommendations for gastric cancer, any cancer in specific, but specifically gastric cancer, is to limit red meat and processed meats to about once a week. The reason for that is it has been shown to have links with cancer, especially gastric and esophageal cancer. The thought is in processed meats, the nitrates in the processed meats, so if you are going to do like a sausage or a hot dog or deli meat, try and look for words that say natural or they say nitrate-free. Those are going to be better options. And then limiting red meat. The reason for that is it has a high heme content, which is basically iron, which is good when you're iron deficient, but too much can be an irritant to the stomach and has been linked to gastric cancer. Okay? Dairy products are another good source of protein, and the more whole fat you can do, the better, as long as you can tolerate it. A lot of times way back when, or just even a little bit ago, everyone was like skim milk is the way to go. But even for non-cancer patients, whole milk is the best. So for cancer patients, it's the best, A, because it provides more calories, and B, because they have found that there are healthy omega-3 fatty acids found in whole milk that you won't get from your fat-free milk. And omega-3 fatty acids are great for your heart, they're anti-inflammatory, and we just need them in general. So doing whole fat whenever you can, it's going to give you the calories you need. So whole fat milk, you've got whole fat cheeses, you've got Greek yogurt, and you've got cottage cheese. So trying to get some of those healthy fruits and vegetables in, take some fresh fruit and combine it with the Greek yogurt or combine it with cottage cheese, so you're not just eating the fruit by itself. And the reason I recommend Greek is because it does have more protein in it. If you don't like the taste of it, try adding it in smoothies, add berries, add a little bit of sweetener, and the whole milk one will taste a little better because the fat-free ones can be very bitter and taste a little bit more like sour cream. Okay? So if you can tolerate full fat, your stomach can tolerate it, go for it. Okay? The other one is nuts, seeds, and legumes. Remember, legumes are any of those beans, lentils, things like that. So you've got nuts, you've got any nut butter, so peanut butter, almond butter, cashew butter, anything like that. And then you want to actually, if you can, pair those with a grain of some sort. And the reason I say that is animal products, so within protein you have like A through Z, and beans only give you like A through G, and while pairing them with a grain, you get the G through Z, so your body can use that protein more completely. And then quinoa is a grain that's a complete protein on its own. So how do you get the most out of eating? Small, frequent meals. A lot of times you have to eat by the clock. Treat your food like medicine. you take pills on a regular basis, you should be eating on a regular basis as well. So that your caregiver doesn't have to keep nagging you if you have a phone, try setting an alarm on your phone to remind you to eat every 2 to 3 hours. And I'm not talking large amounts, I'm just talking little bites. A string cheese would be a great snack, or just even a half of yogurt. You don't even need to eat the full yogurt. But because your portions are so small, trying to eat more frequently throughout the day. Just snack all throughout the day. Add in extra calories wherever you can. So if you have some eggs, throw some cheese on it, make an omelet. You can throw in other types of meat if you'd like. Add Greek yogurt wherever you can, cottage cheese. Add oils and butters. Avocado is not high in protein, but it is high in very healthy fats and lots of calories, so it's another great way to add into your foods. And like I mentioned before, don't just have fruit as a snack. Try to pair it with yogurt or vegetables with hummus, something like that. If you need to, drink your fluids. Hydration is extremely important, so when you can, try and make some of that fluid into calories, like milk. Fairlife milk is a really good option because it has extra protein, and a lot of people like the taste better than a nutritional supplement, like Boost or Ensure, something like that. Juice, if you can tolerate juice, I know juice can have adverse effects if you've had a gastrectomy, but if that doesn't bother you at all, juice is another way you can drink your calories. And just nutritional supplements in general can be beneficial. However, with nutritional supplements, I always recommend that you go for food first before going for nutritional supplements, just because food is always going to be better for you than something more man-made, okay? When you drink, don't drink a lot of water with your meals. Limit it to about a half a cup with every meal that you have, and then drink outside of your meals. And then stay active. Staying active is going to help keep that muscle on you, and it also can increase your appetite because it can get things moving and get things going. Okay, so I kind of mentioned this back with it. What are some things you can have? Make sure you keep food in sight. If you're at the TV, keep some food on your coffee table, out of sight, out of mind, so you want to keep it in mind as much as you can. Have things available. If you're out and about, on the go, have snacks with you. String cheese is a good one. Even those nab crackers they don't have, or the Lance crackers, they don't have a ton of protein in them, but hey, it's something. There are those little Jif, peanut butter packs. You can do those. Trail mix, if you can do that if you don't have any difficulty swallowing. Cheese and crackers is a good snack. Anything like that. Smoothies are another good option, especially if you have difficulty swallowing, and sometimes they can just be a little bit easier to tolerate. When you're not feeling too well, it's easier to sip on things throughout the day than sometimes it is to physically chew and eat. People always ask me what to add to smoothies. You can literally add anything, as long as it's food. But avocado is a great one you can add to it. Flax seeds, nut butters, Greek yogurt, berries, ice cream, bananas, whole milk, heavy cream, anything you want. Bulk it up as much as you can so that when you are drinking, you're trying to pack as many calories as you can into that small volume. Some meals are, you could do chicken pot pie, you can do macaroni and cheese. They're very soft. Again, if you have any difficulty swallowing, these are good for that. Omelets, chicken salad, egg salad, tuna salad, you're adding extra mayo. If you don't want to do mayo, avocado is also really good to mash it up, and you get those healthy fats in as well. And then soups as well. You can also add heavy cream to brothy soups to get a little more bang for your buck in those soups that you're having. Symptom management, I only included 2 just for time because I may be already out of time. So I'll go over these quickly. Nausea, vomiting is one that comes up a lot. The typical brat diet, what you hear of, bananas, rice, and applesauce, anything kind of dry, a little bit easier. You don't want to do very high fiber foods, so lots of fruits and vegetables can be really hard on the stomach. And whole grains can also be hard on the stomach, so you're going to want to do pretzels and bagels, things like that. You're going to want to do low-fat foods. So stay away from fried foods. Red meats tend to be harder on the stomach to digest. So chicken or turkey, and then fish. Actually, a lot of people do well with fish when they're not feeling the greatest. So sometimes I'll even recommend keeping a rotisserie chicken in your fridge and you can just pick at it, because oftentimes cold foods are beneficial when you're not feeling too well. And I know that can be contraindicated depending on your treatment. I know oxaliplatin kind of makes it hard or impossible to tolerate those cold foods, but when you don't have that cold sensitivity, trying to stick to cold foods. Staying away from strong smells, and then ginger and lemon can be very helpful, having a ginger tea or sipping on a little bit of ginger ale as well. And then this baking soda salt rinse is good for if you do throw up, cleaning your mouth. It can also help with taste changes, and it helps keep your mouth clean, and if you have mouth sores or anything like that, it can help prevent infections. So that is a good little recipe all around, just gargling it right before you eat. Heartburn, indigestion, reflux, any of those names. It's going to vary by person, but those are the common triggers for it, just for time. The biggest ones are going to be acidic foods and spicy foods, and then even sometimes soda. Don't lay down right after eating. Try and stay upright, and even walking around can help because you're letting gravity do the work for you and move things down. Okay? And then I'll quickly go over the post-gastrectomy diet. Initially, you'll typically get tube feeds. You'll start on a clear liquid diet, transition to a full liquid diet. During this time, you'll likely be on full support tube feeds. And my recommendation is work with the physician and work with a dietitian if one is available to kind of cater those tube feeds to your needs. And you'll be transitioned then to a normal diet. The best is to stick with low-fat foods and low-fiber foods at first. The goal is to get those foods back into your diet as much as possible, but it takes your body time to heal, and so high-fiber foods and high-fat foods are typically harder on your stomach and harder to get back to right at the beginning. So if you don't tolerate something right away, try it again in a couple weeks or a month, and you may be able to tolerate it after your body has healed a little more. And then a quick note with dumping syndrome. Dumping syndrome can be affected by caffeine because dumping syndrome is basically urgent use for the restroom. And because with a gastrectomy, you no longer have the flap on the bottom of your stomach that helps control the rate of food going into your small intestines, things can flow in more quickly. So the things that can make your food run out of you more quickly, caffeine, because the caffeine can contract your GI system. Fatty foods and sugary foods and drinks. However, the most common one is sugary drinks, just because foods have other components, like brownies and cookies have other components that can help slow it down. So if you need to drink, avoid juices, sodas, Kool-Aid, and sports drinks. The sports drinks I recommend are G2 Gatorade or Propel because they do have less sugar in it, so it tends to not have the same effect. When choosing nutritional supplements, Ensure and Boost and those types of things have a lot of sugar in them, and they can cause that dumping syndrome. So the ones I found are using either a diabetic supplement like Glucerna or a Boost Glucose Control. Boost Optimum is also really good, and you can find your standard ones at any store like Muscle Milk or Premier Protein. However, be careful with those because they are not as high in calories. They're usually seen as a weight loss drink. And so it'll give you a ton of protein and not as much sugar, but it doesn't give you a ton of calories. And our main goal is to get in calories along with the protein, but calories is our number one thing. I'm sorry, I know I went through that quickly, but these are some patient resources. One I want to point out is the Memorial Sloan Kettering Cancer Center. If you have any questions about supplements, that's a place you can go to research, look up your supplements, and it will tell you if there are any contraindications to it. And then the bottom one, Cook for Your Life, has a lot of different recipes and video how-tos that you can look up, and it can be even like, okay, I've got nausea, what are some good recipes for nausea? Or whatever it may be. Or even if you're vegetarian, what are some good recipes for that? That's a really good resource for looking up some recipes. Okay, any questions?
We probably have time for maybe 2, possibly 3 questions, but I'd like to start with one from our webcast. Someone asked that for patients who have a total gastrectomy, this patient seems to have some difficulty with becoming nauseous after drinking water after a total gastrectomy. Can you explain that? Is that something you're familiar with? Or
So that has a lot. It's hard when you have difficulty tolerating water, it could possibly be because of the osmolality of water, and your body wants a little more sugar and salt into it. There are oral rehydration solutions that you can look up online, or Pedialyte, or even just the G2 Gatorade can be good alternatives that they may be able to tolerate a little bit better.
Thank you. Any questions in the audience? Okay, I have one here from when we have for the registration regarding I'm sorry, I'm trying to abbreviate this question here. Is there a diet that patients can use to prepare for treatment? I know we talked a lot today about during treatment and after, but what about before?
Before, the biggest thing is you want to bulk up as much as possible, because treatment can take a lot out of you, and so being best prepared, having even a reserve on your body before going into treatment can be beneficial. So mentioning before, protein is going to be very beneficial, and just bulking up and getting in calories when you can.
All right, any other questions? Oh, one.
I just had a quick question for you. Actually, it's two. Sorry, Mary Margaret. The first one is easy. So you mentioned prenatals. Can men take prenatals?
Men can take prenatals. It won't be, men have higher needs than women do, so it won't be 100% of their needs, but it's, otherwise it's fine. Otherwise it has basic omega-3 fatty acids, iron typically in them, biotin, your vitamin Bs, vitamin C, things like that. So they may just be a little less than what like a male needs, but otherwise there's no harmful effect in it.
Okay.
Yeah.
You want to ask your question?
Not having a stomach where the vitamins absorb a little more differently, not having a stomach.
The biggest ones you want to be concerned more about are going to be like iron, vitamin B12, which typically you'll be getting like supplementation of vitamin B12. Iron, if you're concerned about not getting enough iron, if you take it with some sort of like vitamin C food, it can be beneficial, like even just like tomato sauce or a little bit of potatoes. The reason that is the acid in there helps your body absorb a little more of the iron in it, where usually your stomach provides that gastric, that acid, but without that there, you can supplement it with some food.
And one last question that a lot of caregivers ask me is, when do you ask either your oncologist or the nutrition when it's time for a J tube or an NG tube?
Okay, so we typically try to avoid feeding tubes as much as possible. We want you to eat orally as much as you can. Standard, obviously, after surgery, you're going to have a feeding tube. But it's something that is individually based, to speak with a physician and to speak with a dietitian. Oftentimes, if you can't tolerate any food, you have a lot of extreme nausea, vomiting, where nothing seems to be staying down and there seems to be no cure for it. It just keeps coming. That could be consideration. But honestly, for that, it is very patient-based and it's very individualized, and so it's best to kind of work with your physician and a dietitian to figure out when the best time would be.
Okay, thank you so much.